My name is Andrew Caldwell. I'm the administrator for Presbyterian Medical Services Adolescent Residential Treatment Center.
What is an adolescent residential treatment facility?
So when coupled with adolescents, youth experience substance abuse or mental health issues or behavioral problems during that time, they often become overwhelmed and have a hard time living in the community. So the residential program will provide an intensive help for youth experiencing these problems. They would be able to live at the facility under 24-hour, 7-day-a-week supervision and get the help that they need.
What kinds of situations may necessitate a residential placement?
Residential treatment might be an option if any of the following situations occurs. Adolescents are experiencing risks to their health or emotional well-being. Youth have not responded well to outpatient treatment. Youth are in danger of continuing long-term legal involvement that may include long-term incarceration. Adolescents need further intensive treatment following inpatient psychiatric care.
Tell us about the San Juan County program.
We are a 16-bed psychiatric non-locked residential facility. Youth receive individual, group, family therapy. They also meet with a psychiatrist weekly for medication management. Youth participate in on-site classroom for schooling. Keeping in mind that every youth and family has different needs, our average length of stay at the RTC is 4 to 6 months. We take most forms of insurance and work with all 5 Managed Care Operations, or MCOs, in the New Mexico Medicaid Centennial Network.
What sets our program apart from others in our state?
We're the smallest RTC in the state, allowing us to provide personalized care. We work closely with other agencies serving youth in San Juan County, to include juvenile probation and San Juan County Juvenile Services. We are also the only RTC in the state that does not utilize physical and chemical restraints. We maintain the Joint Commission accreditation and certification from CYFD.
How are youth transitioned after residential treatment has been completed?
Planning is a living process, meaning that the plan often changes and molds to new issues or criteria that present themselves during treatment. Our team works with the youth, family, juvenile probation, or protective service worker or tribal worker to attempt to find resources in the community that fit the family's needs and best supports the youth post-discharge. Aftercare programs should focus on bringing family and community supports to the youth and family instead of making them go to the supports. Youth and family should always feel comfortable with the supports that we put in place. So the transition process begins at the intake. We work closely with the family if probation's involved, if protective services is involved. During treatment, the discharge planning can change on the way it's going to look, so we make sure that we're communicating with the team to make sure that everyone's comfortable with the transition into the home. We seek out services in the community that the family feels comfortable with and that the youth feel comfortable with. If transition into the home is uncomfortable for anyone or difficult to complete, the process will not be successful. So we really try to make sure that the transition back home is comfortable for all people involved.
How are referrals made?
Referrals can be sent by email or fax to the administrator or the clinical supervisor. The information will be reviewed and a decision will usually be made within 48 hours. Referrals should include a recent comprehensive assessment, list of all outpatient services tried, chronological history if the youth is involved with juvenile probation, school IEP and other pertinent school information, and insurance information. Thanks for watching the video. If you have any questions, please feel free to give us a call at 505-324-5855.
Follow us on Facebook, Twitter, and Instagram. For more information, visit us at pmsnm.org.